Good morning, everyone. It'll just be a few moments. Good morning, everyone. I'm Sunnyvale Mayor Larry Klein, and I hope everyone is enjoying the holidays. We're only a week away from Christmas Day. Welcome. This is the 40th installment of my weekly virtual office hour address. People continue to say that they appreciate these weekly live stream addresses and hearing from their mayor, so I'll continue to do it until the end of shelter in place and probably a lot longer. This Facebook live stream event is really great because it allows me to give you some updates, answer some of your questions, and of course, provide some words of encouragement, which, right now it's a little difficult for a lot of people. So thank you for allowing me to continue to represent you and work for Sunnyvale during these ever-changing times. I hope everyone is doing well, staying healthy. Please remember to take care of yourself, both physically and mentally. Uh, the fatigue of staying at home is really bearing down on a lot of people, and I know we've re-entered another shelter in place where, especially during the holiday season, it's difficult, especially now when we're separated from our friends and family during a normally festive time. But for your sake, for your friends, for your neighbors' sake, please, do what you can to follow the county health orders. People need to do their part to stop the spread of the virus. Continue to wash your hands, don't touch your face, reduce the number of people you come in contact with on a daily basis. Maintain safe social distancing when you're out. And of course, remember to wear your mask. It helps, it's mandatory. Someone you could meet could be asymptomatic, or you could be asymptomatic, and spreading it to a friend or a loved one, isn't is would be really bad. And so if you need a face covering, please contact me. At this point, almost everybody has a face covering. I have upwards of 15 now of different designs, different whatever the mood, whatever your mood may take. Have a quite a few number of different face masks at this point. So always have spares in the car and ready to go. Also, remember to get your flu shot. I got mine several weeks ago, and it is important. Especially we finally will be hearing more about the vaccine, the COVID-19 vaccine that's available. But the flu season is here, and so there's a surge of cases, and whether or not it's COVID-19 or soon to be the flu, do what you can to prevent that spread, and getting a flu shot is part of that. So we are now 277 days after the March 16th county health order went in place. And that was an attempt to basically slow the spread of the virus. And we're now on basically our third surge since then. But, since that declaration, a lot has happened. A lot happens almost every day. And, I have daily press conferences to watch, seminars to attend, conference calls to confer or advocate on your behalf. And, it's a busy time. Even with the holidays, things have slowed down a little bit, but there was still a lot happening this week at the federal, at the state, at the county level. So let's go ahead and get started and kind of go through what's been happening over the last week or so. So 2 weeks ago today, and we talked about this last week, even though our region wasn't at an ICU availability of less than 15%. Multiple county health directors came around the Bay Area, came together and announced that they saw the writing on the wall, and the smartest thing to do would go to more restrictive measures sooner than the state is actually requiring. And so Dr. Cody at that point released a new county health order that basically, as of Sunday night a week and a half ago, that dining, takeout would be only restricted to takeout and delivery. Retail would only have 20% availability indoors. Indoor and outdoor playgrounds would be closed, and we'll get to that in a minute. Personal service must stop, so no barber shops, no hair salons, no nail salons. And then it also banned all contact sports like football, so the 49ers and several San Jose football teams are now practicing out of state. And then it also did a mandatory 14-day quarantine for travelers coming from more than 150 miles from the county borders. So, and that was going to be in effect until January 4th. So that was kind of the first step of, we saw the writing on the wall, and as quickly as possible, let's try to do something to save more lives, save some lives, prevent the spread as much as possible. And then last Monday, Governor Newsom had his press conference and basically announced the first two regions, the San Joaquin Valley region and the Southern California region, both had dropped below 15% ICU availability. And so they were going to more restrictive measures, much like we had done from our county basis. And then, and so, of course, from a city standpoint, we started closing down playgrounds. So we closed down playgrounds around the city. And then, also because there's no dining from outside dining, so no al fresco dining was allowed. The Downtown Association basically asked to reopen Murphy Avenue. So if you go to Murphy Avenue, you will see that it's been reopened, and now there's temporary parking along both sides of Murphy for people to drop by and do takeout. So on Tuesday of last week, city staff closed down Murphy Avenue, or reopened Murphy Avenue to cars. And then last Tuesday was our last Sunnyvale Council meeting, regular scheduled meeting of the year, and it was a long evening. We had a very full agenda. It started with a closed session review for the city manager, and the city attorney. And those are, from a council standpoint, those are our two direct reports. Everything in the city gets done by policy and direction that we give to the city manager and the city attorney. And so we did, their closed session reviews, and those went very well. And then we had an open study session where we talked about who will be the vice mayor next year. So as we've talked about, I will be the mayor for the next 4 years, but the vice mayor is still selected by city council. And it's usually, it's a rotating position. And, so several council members said that they're interested, and so that will be decided in the first meeting of the year. And then we also talked about intergovernmental responsibility interests. So all besides being on city council, and every council member has multiple other positions. One of which is to be liaison to a board or commission. So that's a rotating position that every council member slowly works his or her way through our boards and commissions. So sitting in on those and helping, being a resource, being there for if there's questions that staff or that the commission might have for council, and then just to be basically there as an additional eyes and ears of making sure that things are run smoothly, helping out wherever you can, and also being there for residents. It's always, when things are in person, it's always good to see kind of what the different interests are from our different residents that are coming to those boards and commissions besides coming to city councils. So, we talked about what we'd be interested in for our upcoming positions next year, and then also the council members elect. So basically, Elisa Cisneros and Omar Dean, who are our first district council members that will be joining us next year. They also basically said what their interests were. So that's how we started the evening, and then we spent several things. We talked about from a housing standpoint. We talked about our memorandum of understanding for a mobile home community, and so that was the end of a housing study that went over several years that came to council about a month and a half ago. And we talked about what the timeline was for getting the landlords together, getting public outreach so that representatives from the mobile home communities are also at the table, meeting with the landlords, meeting with city staff, meeting with everyone involved to try to figure out the best kind of options from a memorandum of understanding of what a normal increase is on a yearly basis for a mobile home community rent space would be, and then also what when there's a vacancy, how much a specific how much the charge for that space would go up for the new owner. So that's one of the things that we set kind of a timeline of multiple meetings and multiple check-in points with council over the next 6 months, starting in January, as those different groups ended up meeting. So it was basically setting forth the parameters for outreach and the final funding as far as that's concerned. And then another fantastic thing that we did last Tuesday was we approved the preferred concept for the Lakewood Branch Library Learning Center. So this has been going on for a few years now as we worked out a negotiation between a partnership between the city of Sunnyvale to have a library, Sunnyvale School District, which has the Lakewood Elementary right next to where the library was being planned, and of course the Union High School District to basically have a learning center. So having adult classes at that center would make a lot of sense. And so the council approved that conceptual plan, and it really is, and still there's a lot of architecture details that needs to be done, but kind of the roof line, where it would go, what the parking area would be, all that is part of that design. And so, and it's about a 2,000 square foot building. The cost is about 28 million, and that's all estimated right now as we finalize the design over the next over the next year or so. And we need to do, detailed design and permitting. Construction should start sometime in the first half of 2022, and then that the final building, and it should be open by most likely the spring of 2024. So about a year and a half of construction, maybe almost 2 years. So that was a big step forward from that standpoint. It's like it's getting it's getting service to an area of our community that has been underserved as far as the past is concerned. I've had a lot of focus in trying to make sure Lakewood, the Lakewood area is basically well served and represented from a council standpoint. And so this is kind of one of those big things for me is providing a library out there, and it will have meeting rooms for high school students that are out there so that they can actually study. It'll have community rooms so that people can actually meet. It'll have a maker space so that people that want to do 3D printing or other things will be able to actually operate there. So it's actually really good, and it fits in with the rest of the park. Lots of windows, and taking advantage of that location as much as possible. So I really look forward to seeing that move forward over the next year or two. And then last Wednesday, from a state level, and I had talked to the county, when the state order said that playgrounds had to be closed, I talked to the county, and they had been talking to the state, and the state basically a week and a half ago said that playgrounds could be open. And so the county immediately updated its health order, and city staff started reopening its playgrounds by the end of last week. And so at this point, everything's open. They do have the appropriate signage that children should sanitize before and after using the playground, and that and that everyone should be wearing face masks as much as possible. Following those county and state health orders, mandatory mask wearing, social distancing. But for people outside of their bubble, their family bubble. But I think it's great that the kids are being able to get out and enjoy the fresh air. Being locked at home, in their home, in their apartment, whatever that is, isn't good. And so being able to get a little more exercise outside of that is fantastic. And then this week, on Monday, Governor Newsom was in Los Angeles for a photo op. It was a press conference, but it was mainly to highlight that the Pfizer and Moderna vaccines are finally starting to arrive in California. So there is a light at the end of the tunnel. We're still in the tunnel, but definitely Governor Newsom and other elected officials gathered at Kaiser Permanente in Los Angeles to basically be there as the initial doses are finally going to be administered. And that vaccine is the real hope as far as fighting fighting coronavirus and making sure that everyone is vaccinated, and we finally get to a point where we get back to normal. And so that was basically announcing that 33,000 vaccine doses were arriving at 4 different locations around California on Monday: Los Angeles, San Diego, and 2 sites here in Northern California. And then vaccines would be arriving at 24 locations on Tuesday, 5 more on Wednesday. So we're seeing a lot more of the vaccine being spread around California at different locations. And then throughout this week, you've seen photo ops of healthcare workers, get those on the front line finally getting vaccinated. So that was really important. It's a big first step in getting back to normal and seeing those vaccines. And then on Monday afternoon, state officials finally released what I'll say are some long-awaited guidance as far as sports are concerned. And this is outdoor and indoor youth and recreational adult sports, and kind of saying when they can resume, and what the tiers are. So right now, when we're talking about being under complete shelter in place, you know, that's impossible. But kind of going through the different tiers, so, the purple, red, orange, yellow tiers, what that means as far as sports is concerned, has been lacking, I'll say, from a state standpoint, and a lot of school districts have been raising this question. A lot of people in general have been saying, it isn't clear, and finally the state basically broke it down very clearly for the different levels. So from the purple tier, so once we get out of kind of a regional lockdown and back into purple, it'll be very clear as far as what's allowed. So outdoor low contact sports will be allowed. So biking, golf, tennis, pickleball, singles pickleball only, and this is from the state level. Martial arts, no contact, rowing crew, all that will be allowed. And then from the red tier, so that's kind of more slightly less restrictive, outdoor moderate contact sports would be allowed. So baseball, softball would finally be allowed, dodgeball, field hockey, pickleball doubles. So that would be when we get into the red tier. And then the orange tier would be a mixture of outdoor high contact sports. So that's where you start having basketball, football, soccer, water polo, and then some of the indoor. So it's the spread of COVID for indoor contact sports becomes higher risk, and so gymnastics, physical training indoors, volleyball, that's kind of the red tier. And then the minimal yellow tier, that's indoor high contact sports. So now we're talking about indoor basketball, boxing, hockey, martial arts, wrestling. You've probably heard about the indoor basketball here in Santa Clara County that caused a large spread of COVID-19 cases last week, and I think it was like 77 different people at least were diagnosed with COVID, all from an indoor basketball tournament. So definitely it was good to actually see better direction from the state on kind of this mixed this direction as far as sports is concerned. And then on Tuesday, Governor Newsom had more of his standard press conference. At his news conference, he talked about that there'll be 327,000 doses of Pfizer, 60% of which were delivered on Tuesday, and then we should be seeing another 393,000 Pfizer doses as early as next week. So there's a good number of Pfizer doses coming in, and the number of doses delivered by the end of the year could be as much as 2 million doses. So we're starting to see regularity in getting some of those doses. And the first phase of vaccine rollout, and so the governor spent a lot of time talking about that how the vaccine would be rolled out, and so that first 3 million doses will mainly go to healthcare workers and residents at long-term care facilities. So this is the most important people, the people that are dealing with at risk, that are either dealing with people that already have COVID and making sure that they don't continue to spread COVID-19, or those people dealing in long-term care facilities where they have seniors that are very much at risk. And so from that standpoint, it's really important that they do whatever possible, hitting that first group, and then the second phase would be inoculating an additional 8 million others, and they're still figuring out who is in that next group. They're talking about teachers, farm workers, grocery store workers, restaurant workers, all the kind of people that are dealing with the public on a common basis, our making sure our food is available, all that. And I think, that's really, really important. And so, they're still finalizing, getting input from the different counties around the state on that second tier, that second phase of vaccine distribution. So it'll still be most likely several months before, everyday person ends up getting the vaccine, but it's important that those that are affected or conceivably most likely could either dealing with people that are already infected or dealing with people that are high risk. Those people need to get vaccinated as much as possible. And so it's important from a vaccination standpoint that we deal with those frontline workers, those people, that are at risk as much as possible, as quickly as possible. Okay, and then the governor reported, that there have been more than 32,000 new cases of COVID over the last 24 hours. So we've seen a rapid uptick in the number of daily COVID cases, as well as, the number of deaths on a daily basis. I think on Tuesday there have been 142 deaths just in a 24-hour period related to COVID-19. And so, and on average, I think there have been 163 people who had died because of COVID over the last 7 days. So that's dramatically, higher than it was just a week ago. And all-time high of daily deaths have been reported a week ago today of 225 people had died because of COVID-19. So, it's very dangerous. It's very serious. Please, do what you can to slow that spread. And Dr. Galley raised concerns that 2 weeks from now, just looking at the numbers and how they're increasing around the state and our ICU availability, we're really concerned about the ability to provide a high quality level, a level of high quality of medical care around the state, and whether or not rationing care and focusing on crisis care will end up happening. The state had more than 3,000 ICU beds occupied by COVID-19 patients, and that was just Tuesday, and that has continued to increase. And ICU capacity around the state stood at 5.7%, and some areas were critically low. So from on Tuesday, the ICU capacity in the Bay Area was 15.8%. Sacramento had just fallen below that 15% level, so it dropped into 14.9%. Northern California is still up 29%. It's very rural, but San Joaquin Valley was at 1.6%, and Southern California was at 1.7%, and San Joaquin Valley had dropped to 0% once or twice in the previous few days. So, we're in the middle of this third wave of surge, and the governor also talked about that they activated mutual aid for coroners, so for coroners outside of the state, just because they'd seen this rapid uptick in the number of people dying because of COVID-19, and they've brought in on standby 60 53-foot refrigeration trailers and about 5,000 body bags, just because they're worried about coroners being able to process these bodies for those that might have passed away because of COVID-19. So, it's a very difficult time for many, and it's just sobering when we're starting to talk about, body bags and, zero ICU beds, and also conceivably rationing, healthcare. So postponing, optional surgeries, optional procedures until later in the spring because of uptick in numbers and the number of healthcare workers that are available. And so this is the other thing is trying to activate, newly retired healthcare workers to try to bring them in, trying to bring them back to see if they can help out. And then from a county standpoint, let me take a drink. From a county standpoint, on Tuesday, the county supervisors met and they enacted a cap on food delivery fees. And so, this cap is on sets fees at 15% of the cost of an order, and then it will last as long as the ban on full capacity indoor dining remains in effect. So that will be most likely until, my guess is April or May. We'll see. But it's full capacity is basically when we get back to normal, and so I don't see that happening anytime soon. That's when we get back into the yellow phase. So we're talking about probably May or June at this point. So I want to thank Supervisor Cindy Chavez and Joe Simidian for introducing this proposal. We've been talking about this for a while now, and the order takes effect tomorrow, so it starts on Saturday morning. So definitely I've heard from a lot of restaurants that this has been very difficult for them, and I'll say we looked at it from a city standpoint, and the city attorney had some issues with it, and of course what's good about it was dealing with it at a county level. It applied to all 15 cities and the unincorporated areas of Santa Clara County. And then, unless a city enacts a more restrictive fee cap, and we looked at that from a city standpoint, but there were issues with the contracts and conceivably deliveries from outside of our city and how that would apply. The right thing was to have it done countywide, and so I really appreciate what the supervisors did here. And because under COVID-19, most restaurants don't, and most restaurants don't have an infrastructure to host their own platforms for takeout and delivery or have their own delivery drivers. So they were often forced to accept what I'll say are excessive and almost usurious commissions, which could go from 30% to 50% of the food cost. So when you were ordering out when you were doing delivery takeout, some of the delivery services were taking up to 50% of the cost of that meal. So when you looked at what the restaurants were clearing, some of them weren't even breaking even on delivered food. And that's one of the reasons why, for my mayor's restaurant project, I've always done, takeout. It's good to be there and talk to the owners, talk to the workers, also find out what they suggest for if it's a new place that I've never been to before. But also, it's like it saves those costs that the restaurants were bearing as far as delivery fees. So if you can, and I understand not everybody can, but if you can, definitely look at doing pickup, doing takeout from a restaurant if you're ordering from them. And so that goes in place tomorrow morning and will be in place for many months until restaurants get back to 100% indoor dining. And then on Wednesday, the state announced that the ICU capacity fell below 15% for the Bay Area region. So that for us, that didn't mean that much, but it meant that within 48 hours, that all counties in the region, so that includes San Mateo County, San Francisco County, Sonoma, so all areas that haven't already went to more restrictive order, needed to go to a more restrictive order. And so that was at midnight this morning that all those Bay Areas went into that health order. And what's different about this is it's for at least 3 weeks while we maintain that ICU availability less than 15%. So right now, it's at least until January 7th, if not a lot longer. All gatherings are prohibited. The ICU capacity as of today dropped from 14%. It's now at 13.1%. So it continues to drop down. And if like just as an update around about ICU availability per region, the northern California region is still above 20, but Sacramento is now down at 11%. San Joaquin, so the San Joaquin Central Valley area is at 0.7%. And as of this morning, Southern California, which is LA, San Diego, all that area, Santa Barbara, is at 0% ICU availability. So, that to me is shocking. Consider that whole area, that there aren't ICU beds available. So, this is a very difficult time for many. And so, hopefully we make it through as quickly as possible. And from a federal level, I've had several calls this week with our federal representatives. I've seen Representative Rokana several times, but at a federal level, they're still working on a financing package. So today they have to pass an emergency budget package to keep the government from shutting down. They were hoping that the next relief package would be part of that, but of course, negotiations are still going on. It's been about 8 months since the last relief package, the CARES Act, went into place. But Congress hasn't gone home. They're still trying to get this done by Christmas. Hopefully over the weekend they are able to make a breakthrough and figure out how to basically get through everything and get something that supports those people that don't have run out of unemployment insurance, those people that additional funding for cities, for counties, for restaurants, small business loans. So I'm keeping my fingers crossed that the city will also get some of that funding, because we've put out a lot of expenses, and we've also been funding Sunnyvale Community Services, our restaurants, and whatever we can to make sure that our residents are safe. And this is one of the reasons from a federal standpoint that they can print the money that helps fund our local community. And then in today's paper, so if you read today's paper, you saw that Sal Pizarro highlighted my mayor's restaurant project. So I think that was positive. It's positive feedback for the efforts that I've been doing. We're up to 175 different restaurants, and I've also created a new URL. So as opposed to going to larryklein.com and trying to find the right link, and it's right there at the top, but now you can go to eatsunnyvale.com and basically pop directly to my mayor's restaurant page, and I'll be adding more to that in the coming weeks. So we're at 175 restaurants, and I've started going back to a few. Last week was, of course, Hanukkah, so I went back for did the takeout for a Hanukkah meal that the Marvelous Matzah experience has been doing Hanukkah meals, and I was able to basically partake of their sweet potato latkes. So it was actually good from that standpoint. And then, of course, this past week was also halal restaurant week, and we have multiple halal restaurants in our city. So I was able to go back to a few of those that I'd been to before and celebrate halal restaurant week. And actually, earlier this morning, I've already been interviewed by KCBS. So they also were interested in highlighting the project. So if you listen to KCBS radio at noon, or later this afternoon, you'll hear about, hear me once again talk about the restaurant project, which to me has been, a great experience during my time of sheltering in place. And it's actually opened up my eyes for the variety of that we have here in Sunnyvale. It's also been good from that standpoint to just, trying to help out, different restaurants as much as possible. I think that if everybody that could ate out, or now, had takeout once or twice a week, it would help our restaurants make it through this hard time. So if you can, definitely, do what you can to support these local restaurants. I've heard of several of them. None of the restaurants that I've highlighted have shut down, have closed their doors permanently. One owner rebranded. So ultimately he decided that he wanted to go in a slightly different direction. But we've been fairly lucky here in Sunnyvale. I was at a mayor's roundtable earlier this week, and the head of the Restaurant Association of America was there, and he was saying that around the country 1 in 6 restaurants have closed. And so we've been fairly lucky from a Sunnyvale standpoint. I know that there's been a few that, with the close of alfresco dining, that have decided that they're going to temporarily close and then reopen in January. But it's very difficult for a lot of people. So if you can, definitely do what you can to support your local restaurant. Let's go ahead and now get to the health dashboard. From a state standpoint, we talked a little bit about it already, but actually from a national standpoint, we've now had about 16 and almost 17 million, 16 and 3/4 million cases, and that's just up 1 million cases from last week. So that's pretty amazing that just in the last week we went up 1 million cases, and we've had around 300,000 deaths related to COVID-19. So nationwide it's not looking, and then from not looking well, and from a California standpoint, it's also not looking well. We passed 1,750,000 cases, and then we've had about 22,000 deaths from a statewide standpoint. So it's very difficult from a national standpoint, a statewide standpoint, and from a county, things are still looking worse too. We've had our cumulative cases are now, from a county standpoint, at 52,000 COVID-19 cases. That's up 8,300 cases from last week. And that was, you look at the trend, 7,400 the week before, 4,200 the week before that. So, it's peaking in a big way. We've had 566 people die from COVID-19 in our county, and that's up 45 cases just in the last week. So it is pretty sobering. We have 566 hospitalizations from related to COVID-19, and that's up 250. Those are not all ICU related, but we overall, some of them are ICU, some of them are general hospital beds, but we're over up 250 from last week, where we only had about 300. So it is amazing. And then from a city by city basis, San Jose still has the most. They had almost 29,000 COVID-19 cases, and that's up about 5,500 from last week. And then Sunnyvale, we've had 2,180 cases. That's up 350 from the last week, and that's seeing that increase. So we reflect that same increase that other people are seeing. 350 over the last week, 250 the week before, 175 a week before that. So we were in the 50s and 60s about 2 months ago, and now it's 350 new cases a week. So, please continue to do what you can to slow the spread. And from my standpoint, I'm continuing to advocate on your behalf. So at a county level, I continue to have those discussions with the county supervisors, county health, other county departments. Testing, the pop-up van was here at Murphy Park on Monday, and the good thing was all those, every spot was reserved. So there was a lot of feedback that people are getting tested, and a part of this is people being exposed in the last few weeks, people getting sick, or thinking they might have been exposed to somebody who might have been sick. And so, if you need to get tested, you can go to sccfreetest.org. It'll be, the county test van will be back here on December 28th. So you can sign up on Monday, start signing up on Monday for the following Monday. They always put those reservations for appointments are available a week before the actual date. So those become available next Monday. And El Camino Hospital is doing testing, so you can contact them directly. And if you go to sccfreetest.org, there are other locations in Mountain View. The fairgrounds is doing testing as well as flu shots. So depending upon what you can do or what you need, and how quickly you want to get tested, and also your healthcare provider should be able to test you. So that is important, that the healthcare providers are finally really stepping up and giving testing to those people that need it. Next, I wanted to announce some upcoming events. So on Tuesday night, Council will have a special meeting, and so this is, and that meeting will start at 6 p.m. We were supposed to have our last meeting last week, but several things have come up. One of which is the final approval of the contract with our public safety organization. So those negotiations have been going on for some time now, and so that union is voting on that contract, and so it would be the council finally basically approving the final negotiated contract on Tuesday. And then the other thing is several council members brought up looking at conceivably emergency ordinance to delay the implementation of increasing the minimum wage from $16.05 to $16.30. And I talked about this, about a month and a half ago, 2 months ago. Council approved, and ultimately what was approved by the voters several years ago was that we would get to $15 minimum wage, and then every year based upon CPI, our minimum wage would continue to go up. And so that would be automatic unless council decided to delay. And we had a lot of people basically advocate with council, and so several council members brought that forward. So we'll be seeing that on Tuesday night, and and we'll see what the final staff report says. But ultimately, this would be a temporary measure. What's being proposed, temporary measure until the end of the COVID-19 restrictions. And so, a lot of restaurants have asked for this. A lot of workers, of course, are saying, an extra 25 cents an hour will make a difference in my life. So this is to some degree a lose-lose situation, because the restaurants are saying that they might have to close if this is the straw that broke the camel's back. And then you hear from the workers that it's like, an extra few dollars a day will make a difference in my family's life. So, we'll see how council ultimately decides to vote on that. In order for it to be an emergency ordinance to take place before January 1st, it would need 5 of the 7 council members to vote yes on getting that approved. So we'll see where that goes on Tuesday. On Monday, of course, is the vernal equinox. No big celebration, of course, but but it's the end of autumn. It's it's the beginning, the official beginning of winter. But the big thing for me is the days will finally start getting longer. You know, the the seasonal disorder of not seeing that much sunlight, and it's good. I'm hoping people, since they're not, if you're not working, you're getting a chance to get out and into the sun whenever you can. But definitely the sunset, the early sunset, and is really really difficult for evening meetings for me. And so I'm hoping that I'm looking forward to the days finally getting longer and getting a little more sunlight in our days. We're only a week away from Christmas, so next Friday would be Christmas, is Christmas, and so I'm moving. I was thinking about canceling the standard live stream, but I think it's important, with a council meeting going on, to go ahead and have one. It'll be on Thursday morning instead of Friday morning, so it'll be Christmas Eve. So if you want to join me, I'll be back here on Thursday morning at the regular time, 9 a.m. And then this weekend, if you're looking to support Sunnyvale Community Players and actually watch a really great performance, Sunnyvale Community Players filmed a 4K performance of Once on an Island. And they did, it was really innovative the way they did it, because they couldn't do their normal singing because of the county health orders. They could do a certain amount of talking, but they went back and performed separately their performances as from a musical standpoint. They did audio, so they're able to be mic'd and do audio, but it's actually a pretty amazing performance I watched earlier this week with visual effects added. And so it's plays until Sunday afternoon. You can go take a look at, I listed it on a Facebook post earlier this week, but it is really amazing. So if you get a chance to watch that, it's family friendly. It's actually really good to actually see everyone out there performing. And so from my standpoint, it was good to see something that going to a play, going to a musical at our community center isn't allowed now. And so this is a way to kind of get part of that experience and also support a local nonprofit that really needs your support right now. So happy that they were able to put on that event. Let's go ahead and get to some questions before we run out of time. Let's see. Have you any observation about the federal government receiving vaccine doses to shipping locations that are just sitting there, not going out? I heard something about that on this morning's news. Definitely, we are prepared. So the count. So from a California standpoint, we've been fairly well prepared. That and this was basically once we found out the temperatures that the vaccines needed to go to and be stored at were so low, that was one of the things to make sure that being appropriately prepared was critical. And from that standpoint, I think it was really really important that we did all the appropriate planning before vaccines started being distributed. And so from our county, from our area, we're set up. But yeah, I have heard issues that there have been some issues at a federal level of making sure that they haven't been able to being transported to certain areas because they weren't prepared. So we'll see how that goes. But from our area, things are in a good state. I'd like to know your thoughts on a recent protest and damage to city property, local businesses. And oh yeah, so this was a question from last week. And so people who defaced, destroyed property, why are they not arrested, prosecuted? And so this is, public safety was monitoring the marchers, and they didn't do any arrests, and free speech is allowed, but when they started defacing things, when when there were basically confrontations between residents on Murphy Avenue and the protesters. The city manager and the chief basically declared it an unlawful assembly, and they were forced to disband. This was, and from a prosecution standpoint, we've debated. I've debated with the chief a little bit about prosecutions. This is the issue, and the same thing as you look at. We don't do the actual prosecutions from a city standpoint. All that's done by the city attorney. And if you look at the major protests that happened in San Jose, I think almost none of those protesters were prosecuted. So from our standpoint, it's making sure that they disband, they stop what they're doing, and if there is, I'll say a major confrontation or major crime, then definitely they would be prosecuted. They would be arrested and prosecuted. Let's see, anything else? Any other questions? Oh yeah, so what are the fences around City Hall? So, so finally our new Civic Center and a new addition onto public safety are moving forward. So you're seeing the fencing going up around those in preparation for groundbreaking sometime in the next month. And so, this is the addition onto public safety, on the public safety building, to add new emergency operations center, new let's say interview rooms that are a little bit more accessible to the public. And so that will change kind of that entrance. And then the new City Hall, we've talked about the new City Hall, net zero, green, LEED platinum. So a very iconic sort of building, and a little bit easier to maintain. And then our old, 50-year-old brick building, much more energy conscious, a lot more space for employees that are doubling up in cubicles or are in trailers. So it's a lot. It's pretty positive from that standpoint. So happy to see that finally moving forward. What's happening with Macy's? And so Macy's, you're starting to see fencing going up around Macy's. So they'll start the demolition of Macy's sometime in the next month. I think that's pretty much it for the week. Let's go ahead. It's just about 10 o'clock. It's time to wrap up. Thanks for joining me again this week. As always, I'm proud of Sunnyvale's response to the pandemic. I know it continues to be difficult. New issues come up every week, but your actions and your response do make a difference. So thank you for that. Wear your mask, whichever mask you choose. Wear your mask. Get your flu shot. Help your neighbors. Share baked goods. Holiday. It is the holidays, and so I see a lot more people are let's say celebrating the holidays at home. They're not traveling this year, so you're seeing a lot more holiday decorations on people's lawns and people's windows. It builds community. It helps others, especially during these difficult times when we feel so isolated at times. So I'm really proud to see Sunnyvale residents pulling together to help others and help strangers and just try to make a difference. So if you're out on a walk, say hello, wave from a safe social distance. People miss that interaction. Sunnyvale will emerge from this as a stronger community. We're in this together. We'll get through this together. Thanks for listening. And until next week, stay safe, stay warm, wear your mask, and take care of yourself. Until then, goodbye.